Tuesday.
Ma'am.
Oh wow, that's kind of dangerous.
all this.
Probably. Right?
We just started it.
It's okay, we're not IT
Like
people.
when
okay?
she put it in. Just so they could see the cassette. Like what size it was.
Something here? It seems like this would do something. Last year probably doesn't have probably hit. Now straighten it out more here.
Oh. Look at us.
I'm gonna move you to this.
So what's the first position?
Hey,
As far as it goes.
So good to me.
Yeah.
I'm trying to get your knee.
Just
water.
I'll move the table. I'm tired.
As long as it's edible, it's
Yeah.
I know which one she's talking about. Because I looked them up on eBay. There's a joke.
What is it? 1 inch below the patella?
Half inch
Half inch.
below that apex. So just kind of feel in for like right there. Feel like you can feel like where you can kind of feel the joint.
So she's right, there's the base of it.
Yeah, and it's kind of like on the other side. Just feel for where that, you can feel like you can feel the hard part here, and then it goes kind of soft. That soft spot, sorry. You might like, be careful. Yeah, when you're doing this, make sure you have your patients bring their pant legs over their knees or not have their pants on. It'll be real easy, much easier to see the anatomy and what you're dealing with.
And now for her measurements, are we gonna assume that she's something or what?
Well, technically,
I think it's in
we
there.
should have the but like, have any of you guys ever seen calipers?
We've seen it.
You just never use them.
I have them.
We don't have them at our.
We're not about that life.
Now, I know like at beach, you will need to measure.
I think actually.
I'll just do it always. Here's the
She's like,
perpendicular
You know
version.
about that?
It's closing on it.
We
Ours
have
are
to,
like
a
really
lot of
high
places
up.
you can't
yeah, we
even
have to
find
measure
them.
for MJ. Like
Is this
during our
like-
comps, we have to measure.
Is this? No, see, that's not even in
That's
here. I don't even see. I thought we had them. Remember they were in here.
I'm gonna
last
angle
week?
always on the caudate and the cephalic. Just
She,
have it.
you know, is average.
Yeah.
So,
if I was gonna move, if I was gonna do it,
okay, now we're not doing tabletop. We're doing it in the bucky here.
I still
But
got
is it?
angle, right?
If she's normal, you don't need to angle. You only angle if it's small or large.
Okay. So we're just gonna assume she's normal.
She is normal.
Is the collimation?
Her leg, not.
You gotta rotate the leg inward. See, like
She's not normal.
you don't want. So you want to. You're kind of feeling for this. Remember, we want them to be
Parallel. Okay.
yeah,
I don't think not.
or like however you want. Like if you want to look at like the direction your fingers are going, you want them going
That's what I'm going
perpendicular into the table. You want the line parallel, but like if you look at the points, you want them. Okay, but I don't think, are you in?
Is that
detente?
after or before?
Okay, make sure you're 47. I don't think you're in detente this way. Okay, remember we're in bucky. So here we go. Yay, thank you. Okay, so, and then like when you do this, it's always like, okay, well, where do I measure to? That we kind of feel like for where their aces is. And now look, so she's actually like, she could even be considered small. Okay, so you but she's like right on the bubble here, but that's because like right now I'm going up to here, and that's like belt and jean, da 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 da. So
She is whatever you tell me she is.
No.
Oh, I actually. Oh. My shoulders don't like hard things. My head.
So should I angle?
You definitely need
First,
to still
before,
need to, yeah.
or
get
does
them-
it matter?
Well, kind of get it everything lined up pretty well. You want to have them. You want to turn the leg in. Probably one of the last things, just because for some people it might be harder for them to hold that in. And that's where, like I said, you might need. Some patients might not be able to hold it, and you might want to just put like a sandbag against their foot to hold it so it doesn't drop back out to the side. Okay, yep, just like, yeah, you put it kind of just like that. Hold it against there.
So what was she at? What was her measurement?
She was she technically is probably small, so if she, in that case, we would be doing what?
The 5 degree caudal.
Yes, correct. 3 to 5. So she's close. She's pretty close to just like 3 degrees is probably good.
Oh, okay.
You know, if you had like an anorexic person or a kid, you can do the 5. Someone who's, you know, kind of just below that, just do the 3. And just switch to that. And then that one doesn't
This
work,
one just
switch
worked
to
for
this
me
one.
a second ago. What's the problem?
It does that. Yeah, switch, use this one. There you go.
Okay, so foot is turned in. Angle's good. Right below the patella.
Yep.
Right there.
Yep. Good. Just make sure this is now lined up. See?
So just
Now, what I do sometimes, like when I do this, because
go
like,
ahead.
all right, so a lot of times you might run out of the table. How I set mine up, I just learned as a trick, because sometimes you can't, you run out of like moving the bucky. I start mine like that. Okay, I put it down at the bottom.
Oh, so
See
it
what
doesn't have
happened?
to be lined up.
No, it doesn't have to be.
Oh.
As long as you still align, you know, center to your center of your IR. Doesn't matter if it's in the center of the bucky, because the bucky is just what? It's just like a tool.
Yeah, it's just
Okay.
holding it.
It's just holding it. So if you need to do that, you can do that. Right, but we still have a teeny bit off, so just bring it down like that.
Mine's when I'm used to the
Okay.
lining up.
So I always I just learned from years of doing this that to avoid that problem, I always start out with my cassette at the bottom of the thing. Because a lot of times too, like if you have like a really long guy, or you know, it's just.
Is this good for collimation?
I would collimate a little bit more on
Oh,
that one.
sorry.
Sorry, go ahead. And just you can either put your marker in here, or you know, right that you probably don't want to do a whole lot. You can maybe straighten her out a little bit like this. So now we can come back,
Add some more.
come this way, yeah, and now you can come in a little bit more. Okay, but just always make sure you got your marker somewhere on here. Okay, or if it's in the cassette.
All right.
Okay, so now go from here to, we have what next? Internal?
Medial oblique.
Internal medial oblique, or medial oblique. Okay, so you're gonna rotate from where? Good,
From
perfect.
her.
You rotated the whole leg. Good.
Can I put this under here to stop her from moving, or no?
You could. Generally, they're not gonna over rotate on this one. Well, I guess some people might, but it's not super comfortable, is it? It's okay.
She's actually really. I am really.
Okay. That looks perfect.
And then the lateral knee.
Okay.
Do you have the tube angled for the medial?
Same, yeah.
Yeah,
Okay.
keep the tube the same angle at the AP,
We're not doing the
and
lateral
the
oblique.
obliques are the same.
We're just doing the regular lateral knee.
Yeah, lateral.
So get on your side.
But you see, that's all you would have done, is just have it rotated like outward. Okay, now this one. Okay, now this is where I tell you, don't bring the leg over the knee.
She will.
So just, yeah, there you go.
Okay. Because what it can do, I know it's not super, but when you do that, it causes you to bring the leg over more. Okay, so that's over rotating that knee. Okay, we don't want it over rotated.
So for this one, it says to angle.
This lateral knee, we always angle, no matter what size, up.
So that's
5
what
to
you were
7.
saying. If she
So you
was
switch that.
higher up, what's the word? I don't want to use higher
If she
up.
was-
If we had the angle for her last time,
Yeah.
for this one, we wouldn't change anything because it was
No.
already 5 degrees.
Well, no, for the AP and the obliques,
Right.
you keep the same angle. So like for her, we were angling down because she was on the smaller side. Or if she was normal, we'd have a
Oh, okay.
straight tube. You keep those the same. For the lateral knee, you always angle up 5 to 7, regardless of the size. So what I was saying was you have to remember to angle your tube up for these ones. The only time where you're kind of like, if you have a larger patient, you're already angled up, so you don't have to change anything.
So that's 5.
Okay, and you're gonna
Switch
slightly
yourself over.
bend your knee.
And it's centered to where? You guys help me out.
Same spot.
Same spot?
Yeah, the centering doesn't change, but you
Oh,
do
we
want
want
them
her
to
to
bend.
flex
Yeah,
a
you
little,
want
yeah.
to flex the knee a little bit. Okay. Now, remember to make sure you're going to kind of feel for both those condyles and make sure that you see the 2 points look like it's coming a
Do we
straight
need her
line
knee to
down.
come down more in here?
No. And also what you can do, remember when we did the tibia, I said you can kind of feel for that spot on the ankle, like how when
Yeah,
we were
I
getting
never
it.
felt for it. I never.
Okay, well you
feel
kind of
what you
want
were
to feel for
feeling.
that tendon and have it come over. And if you get this perfectly lateral, it usually brings the knee right into line. Okay, and I usually will do a check. I'll check down here and make sure I think that looks lateral. All right. Okay, and
What are
then
we forgetting to do?
you want to
Well,
kind
I'm
of
shielding, obviously, but.
you gotta watch that. See how her knee's right there? Watch that. Okay, and when they do that, make sure they don't just go back and bring it back the other way. Okay.
Where are you putting the center right to?
We're gonna be putting the center right about there. Okay.
Oh,
This is
I
more
thought we had to do
complicated.
it to her camera.
Well,
No?
right, yeah, but remember, it's gonna be. This, we want it like this. So kind of what you're looking for is see how this nice little bump is right there?
Mm-hmm.
You want that to be in the center
Okay.
of your cassette, okay, of your light, your open light. But this is a little wide. We don't need it quite that wide because we're like all the way like that. So,
Okay.
like this, yeah. Kind of give yourself a little. Oh, can you hit that? There we go. I like that.
So
Okay.
straight down the middle,
Mm-hmm.
pretty much.
And then you can just put your marker right there. And again, just make sure that this is nice and perfectly lateral. And
I need
make
to
sure,
this
make
is
sure you're
lined up.
throwing your shield. Yeah, and then make sure you're.
So I can put that back in the middle.
That's why I have to be like in a quiet place.
Just move it.
I mean, you don't technically have to move it. You can just
Oh.
slide it back up.
I'm
but-
just used to sitting in the middle.
Yeah. So, but just remember, you can do that kind of stuff. I know you're used to seeing things certain ways, but there's no, like, it doesn't have to be in the middle if that's not working for you, okay? You can put it down. Same thing, like when we do, well, T-spines, we're going to be doing the 14 by 17 anyway, but, you know, you can always just kind of move your cassette where you need it to be if you run out of table, okay? You don't have to, okay? So any questions on the knees? All right, so now we're going to do the sunrise pictures.
Sunrise.
Okay.
Who else?
I can sit on the table if you guys want me to. I don't care.
That's fine. Stomach,
Sunrise is on her stomach, right?
Yeah, you're going to come onto your tummy for the
I
first
know
one.
what I'm doing, so I'm gonna need actual instructions.
Now remember when we're doing this, like if like our routine was for her, was it her right leg? Okay. Now, and I've done this, especially if you're tired or something, you flip them over on their stomach to do the sunrise view, and you start doing this leg
Yeah, I'll make
because
a mistake.
it's where you were doing it, right? No, we're now flipped over, so don't forget to switch legs, okay? Because
Let's just do this one easy.
no, hopefully your patient was paying attention and they'll go, shouldn't it be the other leg? And you're like, oh yeah, I was just making sure you knew, whatever.
So which one are we doing, left or right?
We're gonna do this one right now just because it's easier.
So 90-degree flexion on the foot.
Mm-hmm. And now she can hold it, so that's
Yeah.
good. Now what you don't want is her to go too past. You want it that. And the trick is also that what's going to be hard is making sure that the foot doesn't get in the way. That's great if they can do that. If they can do that, they probably don't really need to be doing anything. But
So knees 90 degrees, and we need 15 to 20 angle towards the leg. So
towards the knee.
So do I bring this? No.
This way. Here, I'll do this side. We're just gonna.
Oh, that's right. We'll do it for color.
Yeah. It's on like that. Okay. All right, and then kind of what you're looking for.
Can we scoot
Does
her
everyone
over
know what the
to center her? Because the table's not going over anymore.
Can you scoot over a little bit more towards the wall? Okay.
Too much.
That's okay. Okay. Now, does everyone know like what the Toyota sign looks like? Okay, kind of like that in reverse. That's what you're looking for. That's how you know you're lined up good when you get that nice kind of.
Move a little.
Yeah. Okay. Okay. Right there.
Nice.
Okay. Then since we're in the bucky, you gotta also make sure you're lined up. So what can we do? Right like that. See, I didn't have to move anything.
Nice.
Okay. Make sure you put your marker on the right. You're doing the right leg, correct marker, and that's all you gotta do. Okay. Up. Did we check this up? We might be a little bit high here.
We're doing the
We're a
bucky, so
little
it's
bit
40
high.
on.
Yeah, I mean, so it's not going to hurt anything to be a little bit high on this one. You don't want to be under 40, okay? So just make sure you're not under 40. Try to get it right around 40 this, okay?
So just bring it down.
So
a
what
little
would you
bit.
do? You could either bring it down or you could,
Bring her up.
you could bring her up. Yeah, you could do, absolutely. That would probably be the easiest thing. All right, and then make sure you're, and we're actually even really still centered, okay? Okay. Okay. All right, so you can see, and make sure we throw the shield over here. So this is so much easier than doing the next one. Okay, so come on over on your other side. You gotta bring the tube down to here.
This is how they showed us to do it in Chesapeake.
Okay,
Oh,
all right.
she's moving the
You
table.
can
That's good.
just watch out over here. You're gonna scoot all that. You're gonna have to set your patient up. So you have to really change a whole lot of things to do this one. Okay.
So this is gonna be an either or type.
Well, no, I mean, we have both of them on the thing, so I might give you, one of you might get in the Setagas one of you might get this
Well, I'm
one.
saying like in the hospital.
In the
we're gonna do-
hospital, yes,
It's
it
gonna
should
be
be
something
either
big.
or.
Okay.
I don't know of anyone that like insists you do it one way or the other. Usually it's either or, and like I said, I would always do it the other way.
Yeah.
I used to do them this way because I thought this was
Build up.
better for some reason. I think it's because the first time I ever saw anyone do it, it was this way. But after I kind of got, I did them the other way, I'm like, oh, this one, it's way easier to just do it in the bucky.
Is that about a 45?
Yeah.
Okay.
Okay. But I'm gonna need you to scoot down closer to the table here. Because you can see, like, if you're that far away, it's gonna be a lot more than 40 inches. How did that happen?
Oh, this is pushing on this.
Oh, golly, I was like, what in the world? Wait, like I didn't think one of those buttons did that. Okay, so I want to come down. Why is it not coming down?
Is that it?
Oh, I gotta come out of this. That's why probably. No? Okay, so watch the feet. This is such a pain in the neck on this one. I might not even test you guys on this one. You didn't do that.
Just get rid of it.
Like,
One less one to study
well, I
for.
mean, it just to me, it's like there's no reason to do this one. We have
We have the
well, I'll just leave it. Okay, so now you gotta hold this up perfectly straight. And we're doing, let's see, we'll do this knee because this is gonna be a little easier to do, I think.
Now they taught us to chest speak with the cassette.
You gotta match the angle of the face of the tube to here. That's the other thing, okay? So you kinda gotta like, okay, hold that, right like that. So we gotta get it centered over the right knee, or the correct knee. Okay, and we're going that way.
Yeah, there are some patients that would not be able to do that.
See, and
Well,
then
they
like,
taught us with the
okay.
cassette resting on the knees.
well, you can't rest it on the knee because
Well, I'm
how do
saying
we-
like it was like where the patient didn't have to hold it. It was like
no, the patient has to hold it in this one.
Oh.
There's no
you were
way
with
to not.
Nadine, right? When
I
she
can't
showed
remember.
us. Maybe you weren't in there. I don't know.
I don't know how in the world you'd have it.
She showed us
Like,
the other day.
and
And it
again,
was where the patient
tilt it
didn't
right
have
like
to
that.
like hold it in.
But I think she had something holding it on there too.
You'd have to
That was in Ella's
tape.
class.
You'd have
There
to
was
do
two
some
different
kind of
ones in
like
her notes.
crazy.
No, we were in clinicals the other day,
Okay.
and one of the techs showed us how
Oh,
she did it.
okay. No, I wasn't there then.
Okay.
Yeah.
Now
I
this
wasn't
is
over there.
35. Okay, so let me come back a little bit. You're kind of pushing it right now. Sorry.
40. Yep.
Okay, so now I gotta drop it a little bit. All right, so again, kind of look for that little Toyota symbol. Whoop, and you can collimate right like this. You don't need it to be open that far. And then you just quick throw your marker on there and just throw, I mean, all you can do is throw a shield over here. It doesn't really do a whole lot because it's kind of behind it. I guess if you wanted, you could throw something under here.
Your shield on the
Yeah.
sponge, maybe?
Shield on the sponge. You can see how much the sponge is really helping. Technically, she probably shouldn't be quite that much, isn't it? Like 40 degrees.
40 to 45.
Yeah, so that's okay. So there we go. Marker right up there. Okay, but so you can just see that like, this one is just a whole lot more to do. It's not. Is this less or more comfortable than the other? Yeah. See. Okay, and again, you gotta make sure they hold that cassette in the right spot. Okay.
Got it.
Alrighty. And this would be really hard for and she's flexible. You all said she's a flexible person, and she's
Throw it out.
My hand more than anything.
yeah. So okay. All right. So that's that one. Now what's next?
Homeland.
Well, since she's like
Abby, your
this
phone's
position, let's
fine.
do the other one.
That's okay. This is fine.
So we're now doing the fossa pictures.
I'm gonna do the camp.
Yeah, since she's on her back. Just stay right. Just stay kind of right like you are.
Yeah, those are
Oh, right. Yeah, you gotta turn on your tummy. Yeah, so I guess we need to do either one. Okay. Now, the one where they are on the tummy, this is the, I always get these mixed up too, camp commentary, right, on the stomach, right like that. And you need, now you can see, like, if we had this, it would be good to rest this up on, but let's see, we probably have some other ones.
You can take it.
Oh, we're gonna try to.
Yeah, just so
Should
she
we?
can.
Would we use this?
It would be easier if we had that one to use.
still might need a little more, right?
Oh, that's pretty good. That's about 45. That's, yeah, that's good.
Ow. That sponge is trying to slide.
And then this one is in the bucky. Okay.
So move her first, or what do I do first?
Well, let's get this lined up, and actually, this is probably gonna be okay. Yeah, put it back in the.
Back to the bucket,
It's probably to be. You might need to go get the side to side.
Katie, what's it on percentage wise?
I don't
Which
know.
knee are we doing first of all? This one?
Whichever one you
18.
feel like doing.
The one closest, yeah.
Okay.
Get better yellow.
Make sure we're side to side the Tonti too, because
No.
I might need to out doing that last one.
I know it's
Watch your head, boo.
And then
Then move the table.
make sure